Welcome back to the Rhode Show. This morning in the buzz, stalled contract negotiations between United Healthcare and Care New England may cause 3 Rhode Island hospitals to sever ties with one of the state's largest health insurance providers. This is kind of a mess, guys. Care New England, which owns Kent Hospital, Women and Infants, and Butler Hospital, they've actually hit a stalemate in negotiations with United Healthcare over premium rates. Both companies now say they cannot afford what the other is asking. So, if an agreement is not reached by the end of the month, thousands of Rhode Islanders could be left without health care coverage at their regular hospitals. Now, many patients have been learning about all of this through the mail, that they could be shut out of using their normal doctors. Take a look.
These letters are only making it worse, making me more nervous, worrying about my health, and that's not easy to put up with. So if I got to go to another hospital, once I get stable that can't, I'm still stuck with doctors not knowing who's doing what, and they change my medications on me. I can't afford that mistake. My nerves are on end, and it's just got me worried about having to find all new doctors when I've been with this doctor for 20-something years.
Now, ponder this for a second. This is just one woman's story. I mean, there are literally thousands of people that could be affected by this. Patrick, you were telling me that you actually did receive one of those letters in the mail, and I'm sure your concern level went right up there.
This is a joke. It's a complete joke. This whole healthcare system in this country is a joke, and it needs to be fixed. And I don't know who's going to fix it, but I did get one of those letters. And according to the information that I was provided from Women and Infants Hospital, because we're about to have another child, was that United Healthcare made $4.8 billion in profits last year. That's with a B. Now, I sent an email to Stephen Farrell, the CEO, the president of United Healthcare. I did not hear back from him. This was about 2 weeks ago. And I said, Steve, this is a joke. You need to fix this problem. This reminds me when I used to do sports, when there was labor arguments in the NFL, when you had millionaires arguing with billionaires about who was going to make more money, and in the end, it's the fan that gets screwed. And in this case, it's the consumer, like myself, like a lot of people out there that are watching, that are going to get screwed. Figure this thing out, and figure it out quickly, because it's going to affect a lot of people, and I'm passionate about this.
Of course.
Because, it affects me personally, but I think I speak for thousands of people out there that are watching right now.
I mean, so you're basically thinking that this whole, we can't afford what the other company is asking for, is just a line. It's just a line.
Listen. The healthcare companies are lining their pockets with money. They're making so much money, and it needs to be regulated. It needs to be fixed, because this problem is only getting worse, and it's about to reach another level of severity here in our own backyard.
So what are you going to do, Patrick? Let's say this doesn't get figured out. You have a baby on the way. What do people like you do?
Well, thankfully, there's this continuity program that if you're like in your second or third trimester, in my case with the Women and Infants, with the baby, that you can still receive the care. But there are other people like that woman right there that, I'm sure there isn't a clause like this. I'll let Ben chime in as well.
I mean, there are thousands of people in Rhode Island that are going to affect it. Having a relationship with your doctor is one of the most important relationships you can have. And like this woman said, I mean, there are thousands out there that have been with their doctor for 20 years, that they know there's some, they know their patients really well. And I mean, Pat hit it on the head. Who gets affected by whenever these big companies argue over this? Who gets affected? Common people.
All I know is that my monthly premium out of my paycheck goes up every year, that I lose money. My co-pays are going up, whether it be at the hospital or normal doctor visits, and prescriptions are going up. Who's making the money?
Well, listen, I am sure.
Who's losing the money?
Yep.
And you.
Hands are up. All right, and I know that everybody's going to be buzzing about this on the live blog, Courtney. I'm wondering if you're hearing from people already that are affected by all of this.
Absolutely. We have quite a few people on our Facebook page who are affected, so I'll share their stories with you in just a minute. We'll start on the live blog on foxprovidence.com, and this one's from Lisa G. She said, yes, I will be affected, and my disabled mother, who gets all of her treatments from Kent. She said they have already sent her letters not covering the medication that she needs. And Smokey Wolf says, I think we should do what the European people do with their healthcare system. Here's the poll right underneath the live blog. If you're just joining us, you want to weigh in. Are you being affected by the healthcare negotiations? A, yes, I worry I'll have to get new doctors. B, no, but I know many who are affected. And our friends on Facebook have been weighing in for the past hour. And Brian Birch says, I haven't been able to afford insurance in 4 years. Being self-employed isn't profitable in this state. And Lisa McChrystal says, we own our own business and pay for health care coverage. I am in my 3rd trimester of pregnancy and have 1 week to go. It's very disturbing for me to receive the letter saying that after January 1st, I will not be covered at Women and Infants. But she goes on to say, luckily my doctor was able to clarify those conditions. So we will be back at the end of the show to see how you feel in those poll results if you or anyone you know is affected.